Hi, welcome to part 2. I've got some great recovery tips for you, but first let's talk about what to expect on your surgery day.
Don't forget, if you were instructed to not eat or drink anything after midnight the night before your surgery, then that includes everything. No morning coffee, no food, no water, not even gum. If your physician or the hospital instructed you to take certain specific medication, such as your blood pressure medication, the morning of your surgery, then go ahead and do that with a very small sip of water, but only if you were instructed to do so. Otherwise, nothing in your mouth before surgery. If you ever use an asthma inhaler, even if only very rarely, bring the inhaler with you to the hospital or surgery center. Your anesthesiologist may instruct you to use it after he or she has examined you, so please bring it with you just in case. Usually you'll be instructed to arrive about 2 hours prior to your surgery start time. You'll be asked the same questions repeatedly by almost everyone you encounter, particularly who you are and whether you're having surgery on your right foot or your left foot. Don't let this alarm you. No one has forgotten. It's standard procedure to ask these questions. There'll be several people with you in the operating room during your entire surgery. Besides your surgeon and your anesthesiologist, there will also be a few nurses and technicians. This is all standard and everyone is there for you to ensure that your surgery goes very smoothly. Oftentimes, foot surgeries are performed with sedation or sometimes called a twilight sleep. During these instances, you'll be put under a very deep sedation using medication through your IV, while the surgery area is injected with an anesthetic or numbing medication. So you'll be unaware that there's a needle in your foot. And once that numbing medication has been injected into the foot, the anesthesiologist adjusts the medications being delivered to you so that you're basically comfortably sleeping but breathing on your own. And your surgery area will be completely numb for many, many hours. Most patients do extremely well with this type of anesthesia. The most common worry that patients share with me when they're anticipating sedation is waking up and seeing something gory. That's not going to happen. If for some reason the anesthesiologist has kept you very lightly sedated and you were to wake up, all you would see are a lot of drapes and your anesthesiologist. He or she is going to be right there with you the entire surgery. If you're having an ankle surgery or surgery on the back of your heel or your Achilles tendon, you'll most likely have a general anesthesia, during which you'll be completely under and you'll be intubated. General anesthesia is also very common for many types of surgeries. Once your surgery is complete, you'll be transported to the recovery room where you'll be monitored for about a half an hour. Then, if you had an outpatient procedure, your friend or family member will be allowed to take you home.
Okay, now we're going to talk about your successful recovery. We have Kathy with us, the world's best MA. She's demonstrating some good habits of a recovering patient. I'm going to point out a few of them and I'll go into detail in a little bit. She's got her leg elevated above the level of her heart. She's got a cold pack. She has her medications with her physician's number and pharmacy number, pen and paper nearby to keep track of what she took and at what time, phone nearby, and plenty of food and drinks to take her medications with, and some good entertainment.
We're going to review all these topics and I'm going to include some tips and demonstrations for you. The number one thing you're going to want to do after surgery is to keep the amount of swelling to a minimum. Ice and elevation are the best ways to minimize swelling. Swelling can make a significant contribution to the amount of pain you experience after surgery because excessive swelling is going to stretch the nerve tissue and nerves don't like that. You're going to have swelling with surgery anywhere in the body, but especially the foot because of gravity. Look how swollen this foot is 5 days after surgery. The entire foot is swollen in black and blue, not just at the surgical site. This is a normal amount of swelling a few days after foot surgery. This is a patient who did a good job elevating her foot. Even 6 weeks after surgery, it's still quite a bit swollen, although certainly much less so. The foot's at the very end of our body, so we really have gravity working against us. That's why it's so important to elevate your foot after surgery. Ideally, you want to elevate the leg above the level of the heart. Unless you're really flexible, that's going to be difficult to do while you're standing or sitting up. So the trick is to lay back and place a few pillows under your leg. You're obviously going to have to sit up to eat and go to the bathroom, but lay back and elevate your foot as much as you can those first few days after surgery. Also, try to elevate your foot at least slightly anytime you're sitting down for several months after surgery. A small footrest under your desk or work area can be very beneficial. Okay, let's talk about ice. There are a few different good places to put a cold pack after surgery. If you had surgery on your bunion or toes, one good place you can put a cold pack is on top of the foot. The inside of the ankle or the side where your big toe is also a great place to put a cold pack because a major artery that supplies most of the foot runs right along here at the ankle, and placing a cold pack here will cool off the majority of the foot. If you have a removable type cast boot, you can either place the cold pack directly on top of the boot or slightly loosen the boot only if you're laying down to aid with placement of the cold pack. But do leave the boot on since it's stabilizing the surgery site. If you have a cast or a splint, an excellent place to put a cold pack that will be very effective for you is the back of the knee. The artery that runs behind the knee ultimately branches out and supplies the majority of the foot and ankle. So this is a good place to put a cold pack for any type of foot or ankle surgery, especially if you had surgery on the back of your heel, which can be a very difficult area to ice. If you have peripheral vascular disease, otherwise known as poor circulation, or if you have neuropathy, otherwise known as numbness, please use caution if you're instructed to use ice or a cold pack, and only use a cold pack if you're instructed to do so. Let's discuss prevention of DVT, otherwise known as deep vein thrombosis or blood clot to the leg. Anyone who has an immobilized limb, such as someone who's placed in a cast, or has walking restrictions, or even anyone who's on a long cramped plane flight is at risk for a DVT. Kathy is showing us some flexion extension knee exercises that can help prevent blood clots to the leg. She's simply bending and straightening her leg at the knee. She's going to bend and straighten her knee about a dozen times, at least 3 times a day. Go ahead and do both legs. I recommend this preventative exercise every day until you no longer have walking restrictions and are no longer wearing a cast. Now, if you're young and healthy, you are in a low risk category for a DVT, but it can happen to unlikely patients, so do the precautionary exercises. A DVT can be lethal if it's left untreated. Signs of a DVT include a warm, swollen, tender calf. There are several factors that will put you at a higher risk for developing a DVT, and if you have one or multiple risk factors, or if you're traveling a very long distance by airplane at some point during your recovery, your physician may choose to place you on an antithrombolytic medication, so be sure to let them know if you have any long travel plans. Also, wearing a compression stocking, otherwise known as TED hose, on the opposite side, the non-surgical side, can even help protect against DVTs. And once your incision is completely healed and enough swelling has resolved to comfortably apply and remove a stocking, wearing a compression stocking on the surgical side leg can give added protection against DVTs, and it's also a great way to reduce the residual swelling in the foot and ankle, which can provide more comfort and make returning to your regular shoes an easier transition. I recommend them for most of my patients. You can get ones that are knee high or thigh high, or ones that pretty much look like regular gym socks, and they're available in a variety of different compression strengths. Another preventative exercise is to simply sit up a few times a day, take a deep breath, and cough. This will help prevent a condition called atelectasis, or basically tiny collapses within the lungs that can sometimes occur when you're lying down for long periods of time. Do this the first few days after surgery or until you're sitting up more regularly. Now let's talk about your bandages. Be sure to follow your surgeon's instructions regarding your bandages. If you're having significant pain despite elevating your foot and taking pain medication, there's a chance that if you have an ACE wrap over your dressing, it may be on too tight, which occasionally happens sometimes when the foot swells. If you're in that category, you may need to rewrap the ACE wrap, and we're going to demonstrate that for you. When rewrapping an ACE wrap, always start at the toes and roll up the leg. You want slight compression, not tight. And you want to have less and less compression as you're moving upward toward the knee. This directs the swelling in the proper direction that the veins and lymphatic vessels uptake and drain extra fluid. If there's some blood on the dressing and even through the ACE wrap, that's completely normal. I always instruct my patients to leave the sterile surgical bandages underneath the ACE wrap alone. You want your surgical site protected with that sterile wrap. The safest way to protect your surgery site or cast from shower water is to take a sponge bath until you're allowed to get the area wet. Or you can purchase a product that's designed to create a seal around the leg to protect the surgery site. I know some of you are already picturing duct tape around a plastic grocery bag, but I've seen too many of these constructs fail, and it's definitely not worth risking getting an infection. Arthritic hands, or you just find using crutches very difficult, you may be better off with a wheelchair, or you may want to consider renting or buying what's called a rollabout device. Insurance companies typically won't pay for these, but they may be well worth the investment. If you're partial weight bearing, then you'll place your foot in a normal position in front of your body, but you'll distribute part of your weight to your crutches or walker. Whether you have a surgical shoe or a surgical cast boot, if you're allowed to put weight on it, you should try to match the same height of shoe on the opposite side to avoid imbalance that can lead to hip and back pain. The cast boot heel can sometimes be quite high, so you may want to try a clog type shoe or a wedge heel or a tennis shoe with a generously padded heel on your opposite foot to match that height. The heel on the walking cast boot is typically rounded and acts somewhat like a rocking chair. You want to simply place the heel down and let the boot roll you forward into propulsion. Now let's talk about your postoperative medications. Narcotic pain medicine can tend to make most people a bit tired and forgetful, so it's important to keep track of the time and amount of medications that you're taking by writing it down. Many narcotic pain medications also contain acetaminophen. That's the same ingredient as Tylenol. The maximum amount of acetaminophen an average size adult should take in a 24-hour period is 4 grams or 4,000 milligrams. So please be sure to pay attention to how much you take and avoid exceeding recommended amounts of any medication. Most narcotic pain medications will make most people extremely nauseated if you take them on an empty stomach. Always take pain medication with food. Antibiotics work by disrupting the replication cycle of bacteria. So if you're taking antibiotics, it's extremely important to take them at appropriate time intervals in order for them to be effective. So again, write down the time that you took the medication and space them out according to the instructions. If you didn't get a prescription for antibiotics, don't worry, not everyone does. You may have received a prophylactic dose of antibiotic through your IV when you were in the hospital. If you were told to take an anti-inflammatory medication such as ibuprofen after your surgery, or if you were given a prescription strength ibuprofen, please keep in mind that the maximum adult dose of ibuprofen is 3,200 milligrams in a 24-hour period. Only take anti-inflammatory medications after surgery if you were told that it was okay to do so. And always take these types of medications such as ibuprofen with food to avoid GI complications. Sometimes after surgery, the sleep cycle can get a little disrupted. Also, many patients tend to experience more pain at night due to the lack of distractions that are more typical during the day. If your physician wrote you a prescription for a sleep aid, take it if you feel you need it. If you think you're having an allergic reaction to any of your medications, such as a rash, stop taking the medication and contact your physician's office. Have your pharmacy number on hand so that your physician's office can call on a replacement medication if needed. If you think you're having a life-threatening reaction or emergency, call 911. Don't underestimate the importance of good nutrition. Your body needs plenty of high-quality protein, vitamins, and minerals in order to heal effectively and efficiently. Try including fish, eggs, nuts, spinach, beans, and a variety of colorful veggies. Narcotic pain medication can and often does cause constipation, so be sure to add prunes and apples to your diet and stay well hydrated. Antibiotics can disrupt the normal healthy bacterial flora within your gut, so add Greek yogurt that has live and active cultures. Most American yogurt is loaded with sugar, and you don't need that, especially if you have diabetes. Go for plain Greek yogurt that's high in protein and calcium. Always remember, if you have any questions or concern, your surgeon and your surgeon staff will be happy to answer them for you. Thank you so much for joining me. I wish you all the best in your recovery.